TV network presents Meet the Doctors, where we introduce you to leading healthcare experts.
Hello and welcome to Meet the Doctors. I'm John Eastman. You know, if you've watched this program before, you know that we bring you some of Central Florida's most prominent healthcare professionals. Well, in the next half hour, we'll be talking about Botox, we'll be talking about back pain, and we'll be talking about breast cancer. So it turns out to be a very informative and exciting show. Let's get started, shall we? Our first guest in the studio is Dr. Brian Haas. Welcome to the show, Dr. Haas.
Thank you, John. It's a pleasure to be here.
Doctor, you are an ophthalmic plastic surgeon. Now, give us an idea of exactly what that means, ophthalmic, is in terms of plastic surgery.
Ophthalmic plastic surgeons are ophthalmologists who are additionally trained or experienced in the practice of plastic surgery around the eyes, the eyelids, the tissues behind the eye, basically the upper face and the mid-face and the tissues around the eyes and behind the eye. And we approach it from the perspective of an ophthalmologist, where function and protection of the eye is of paramount importance. But we also have a very strong cosmetic orientation as well.
Okay. Where did you get your training?
I trained medical training was at Manhattan Eye, Ear, and Throat Hospital in New York, where I did my residency training in ophthalmology and ophthalmic plastic surgery. Before that, I went to medical school at Columbia University, and before that, I was an honors graduate at Harvard University.
And how did you wind up here in Central Florida? Is that a long story?
It's a long story, but suffice it to say, I'm glad to be here.
Okay, all right. And we're going to talk today about your involvement with a very controversial subject, and that is Botox. How are you using it in your practice? And you've been using it for quite a long time, isn't that right?
Yes, John. I was fortunate to have trained in one of the hospitals where the original trials were done. A lot of people don't understand Botox was actually developed by ophthalmologists first for functional problems related to the eye, both the way the eye is turned and also spastic conditions of eyelid closure. And the hospital where I trained was one of the first hospitals in the country to be using it. So I've actually been lucky in that I've been using Botox for 15 years continuously. Really? At very high levels of volume throughout that entire time. First in the training hospital, and then after that, as the chief of ophthalmic plastic surgery at Bethesda Naval Hospital, I was the only one in the department or in the hospital that had any significant experience with Botox because of my training prior to that. So for those 10 years at training institutions, I did it on hundreds of cases a year. And since I've been in private practice, we've been using it for functional and for cosmetic use for the last 5 years.
So in terms of experience with Botox, there are a few people in this area that have as much experience as you.
That may be true.
Now, in addition to using it in your practice, you've trained others to do it. And in fact, one of the reasons 48 Hours came to visit you, was it 5 years ago?
Yeah.
Did a story about you. Tell us about that.
Well, yes, it was on a slightly different subject, but about 5 years ago, 48 Hours featured me and a patient of mine who had been burned by cosmetic laser surgery, and I had done some reconstructive lid surgery on her. And they followed us in the before, during, and after phase of our surgical treatment. And fortunately, the patient did very, very well.
Good.
She's still a patient of mine, and I've done other surgeries on her since then. She's turned out very well. And I hear from 48 Hours that this has been one of their most popular segments.
Most popular segments, yeah. Right. Let's go back to Botox for just a minute. When we say the word Botox, it makes us stop for a minute, because this is a very, how do I say it, potent drug?
Well, true.
Give us the background on it.
True. On a gram-for-gram basis, it's the deadliest neurotoxin known to man.
The deadliest neurotoxin known to man.
Absolutely.
Yet you're using it on a daily basis.
Absolutely, and safely, too. Because at the quantities and concentrations we use it at, it is very safe when used by experienced surgeons or in experienced hands. Now, that being said, I do not want to lead people to believe that there are no problems with it or there can be no complications. There can be complications. Complications can be significant. They include a possible droopy lid or a turned eye. Fortunately, if they occur, they are only temporary, just like the benefits are only temporary. In my experience, they usually occur in the hands, when they're administered in the hands of someone with less or minimal experience. In fact, I get a lot of patients who come to me. I do all my own injections. I drop all my own medication because there's a widespread concern among patients because they've heard that it's a serious neurotoxin. I get patients who come to me because other doctors actually have nurses injecting this. Some other doctors in this area have nurses inject it, And they're concerned about it, and for my patients, I drop the neurotoxin and I inject it myself.
So if I'm a potential patient
Sure.
and I really want to make sure that the surgery, or not the surgery, I should say, the treatment that I'm getting
Right.
is administered correctly, I want somebody with a lot of experience.
Absolutely, absolutely. And your risk of complications is exceedingly low. I can honestly say that we've had no significant functional complications in the past 5 years of injecting Botox.
Let's talk about Botox and what it does. You mentioned earlier, this is kind of an interesting thing about Botox, but the effects are temporary.
Correct.
Tell us about that. What does that mean?
It temporarily paralyzes the neuromuscular junction. It basically temporarily, for a period of 4, maybe to 3 to 6 months, paralyzes the muscles around the eyes so that they can't squeeze if there's a spastic condition, but more importantly, and at this point, for cosmetic usage, which is, as you know, burgeoning because of the recent FDA approval for cosmetic purposes,
Right.
Although we've been using it for cosmetic purposes for a number of years now. Again, the use for cosmetic purposes was developed by ophthalmology as well. What it does is it paralyzes the muscles that create wrinkles around the eyes and in the forehead. And by it doesn't completely paralyze them, but it weakens them enough so that it softens or eliminates the wrinkles around the eyes and in the forehead and the glabellar area. And it's quite remarkable in its ability to do this. And patient satisfaction is extremely high with this procedure. It's a short procedure. It takes about 10 minutes to do.
Really?
Or less. The complication rate by an experienced surgeon is very, very low. And there's rarely any kind of bruising afterwards. And the effects kick in and start in about 2 to 3 days, and they continue for about a week to 10 days, and they last sometimes up to 5 or 6 months. So it is only temporary, but it lasts 5 or 6 months, and it's a 10-minute procedure that can, in some cases, virtually eliminate wrinkles that concern patients around.
And the alternative prior to this was surgery, is that correct?
Correct. And in fact, for the crow's feet, the area around the eyes, in fact, in my experience, surgery there has never been as good for crow's feet, those wrinkles around the corners of the eyes, as Botox has been. Botox is better than surgery for that.
And let's talk about recovery time, too, compared to other procedures.
There's no recovery time. I have patients who come in at 7:30 and go to work later that day.
The same day?
Same day.
The same day.
Absolutely.
Are you finding that this is becoming more and more popular as the word is getting out?
Well, with covers on Newsweek and the Sunday New York Times Magazine, it's just, interest is just mushrooming. And I think it's a great thing for everyone, including the patients who have functional complaints, because the more people know about it, the more they'll understand about it, and the more they'll understand that it is a safe and very effective cosmetic procedure, but with certain caveats, as we mentioned before.
And those caveats are primarily that you have to be in the hands of somebody who has a lot of experience, because this is, number one, it's a very dangerous neurotoxin.
Correct.
But in the hands of an experienced surgeon,
Risk is minimal.
risk is minimal.
You know, complication that a droopy eyelid or double vision in a cosmetic patient is a significant side effect, even if that's temporary. And the way to avoid that is to make sure that, the way to avoid that is to make sure that you're in the hands of someone who's very experienced.
Dr. Haas, we have a lot of viewers right now who probably are sitting on the edges of their seats, who have been thinking about looking into Botox. If they want to call your office, if they'd like to find out more about how to reach you and how to schedule an appointment, how do they do that?
Well, my address and phone numbers, I think, up on your monitor. They're welcome to call us. We have we put aside a special time slot early in the morning before working hours for our professional patients. That segment of our population is also mushrooming, and so we have a time before regular work hours where we can see patients, administer the Botox, and get you back to work on time, and so it really disrupts your day or your week minimally. So we try to accommodate our patients as best we can.
Dr. Haas, thanks so much for being on the program today.
Thank you, John. It's been a pleasure.
And please stay with us. We've got more to talk about today. Breast cancer, back pain, it's all coming up next here on Meet the Doctors. Don't go away.
The right image can pave the way to a bright future. Hi, I'm Lauren Benjamin. At Azana Imaging Studio, we want to help you to develop that image. We offer the ultimate in hair design, nails, barbering, natural tress, makeup, and image consulting. We service a multicultural clientele and are available for weddings, photo shoots, and personal or commercial image consulting. Come visit our friendly staff. Azana Imaging Studio, the ultimate salon experience.
Welcome back to Meet the Doctors. I'm John Eastman. In this next segment, we're going to be talking about breast cancer. It's a subject that is very important, and we've been hearing quite a bit about it in the news. And we're quite honored to have in our studios today Dr. Jorge Otoya. Dr. Otoya, welcome to the show. Doctor, you are a hematology and oncology specialist, is that correct?
Yes.
All right. How did you get interested in that practice?
Well, cancer is very strong diagnosis, and it provokes a significant impact in the psychic, in the psychological aspect of patients as well as physically. And I believe that the physicians, per excellence, really help patients that are suffering.
And that's part of what you bring to the practice, isn't it?
Yes.
It's not just about the disease, it's about the person.
Right.
Now, give us an idea of your background. Where were you born, and where did you go to school?
Well, I'm coming from Peru, and I went to University of San Marcos in Lima, Peru, and then I moved to America.
How did you find yourself here in Central Florida?
I trained in Chicago, and after my training, I wanted to come to Florida. Central Florida is a very nice area to live. I'm very happy to be here.
Now, you're now with the Osceola Cancer Center, and this is a lot of people don't know this, but it's a state-of-the-art facility. Tell us about that.
Well, we have a comprehensive cancer center in Kissimmee, where we provide patients with treatment for cancer, radiation therapy, and we give emotional support.
That's important.
Yes.
Yeah, in addition to the treatment itself, the emotional support, because so much of what the patient is going through is emotional and spiritual and all of that.
Exactly. A diagnosis of cancer provokes a lot of problems, emotional problems in a lot of patients.
Yes. Let's talk specifically now about breast cancer. I don't know if there's any real way to prevent it, but you said something to me earlier today that was kind of interesting. You compared the breast cancer rate between Asian women and American women. Can you comment about that?
Yeah, well, for years and years, epidemiologists basically have found out that the cancer in America is more prevalent and more significant than in other areas like in Asia. And one of the thoughts is that maybe diet has to be something with that. Our American diet basically contains approximately 30% of fat, comparing with Asian women whose diet doesn't contain much of fat. So therefore, we believe that fat intake has to be something with breast cancer.
There has to be some relationship between the two.
Exactly.
And so is that a way to help prevent having that knowledge? Would you consider that a prevention method by adjusting the diet?
Yes, probably will be some ways to modify your alimentary habits and decrease your intake of fat. There are some other factors, hormonal therapy in women who've been taking birth control pills, or late in age been taking hormonal replacement therapy for more than 10 years. There is a slight risk of having breast cancer.
Let's talk about the woman who comes to the Osceola Cancer Center and who has suspicions that she has breast cancer. What happens when they enter that facility?
Yeah. Most of the time we do receive our patients referred by primary care physicians or surgeons who have already diagnosed breast cancer through a mammogram, physical examination. They have gone to a surgical procedure, and they are referred to our center for further evaluation and further recommendations. And that could include the use of radiation therapy or chemotherapy as an adjuvant treatment to complete and secure the patients will be cured from this malignancy.
This is a very common malignancy now, isn't it?
Yes, females are one of the most common malignancy, the most common malignancy.
In terms of detection of this cancer, how important is it to detect it early?
It is very important. The sooner that is being detected breast tumor, the better. Simply because cancer are detected in early stages, and the earlier the stage, the prognosis and survival and the chances of curability are better. So therefore, here in America and in most part of the world, part of the detection of breast cancer is the use yearly of mammogram. Anybody who is more than 40 or sooner, if they have a strong family history of having breast cancer.
So is it the age of 40 that most women should start being concerned about this, unless they have a family history? Is that what you're suggesting?
Yes. we have guidelines, and one of the guidelines is that women who are 40 or more should have a mammogram. The breast cancer in younger women are less often seen. As I was mentioning to you earlier, 5 out of 100,000 women will have cancer if they are less than 30.
Less than 30, okay.
And that risk increased to 150 to 200 per 100,000 women who are in the 60 or 70. So therefore, the benefit of mammogram are mostly in someone who is more than 50 years of age.
So the older you become, certainly as you pass 40 and then into 50, the mammogram really becomes important.
Very important.
Very important.
Right, very important.
Let's talk about some of the methods of treatment. Of course, there is surgery, but you offer some other treatments as well. What are they and how do they work?
Well, the treatment that we offer for breast cancer, that will depend on the stage of the disease.
Mm-hmm.
If this is a small tumor and patients have mastectomy, we offer radiation therapy. If they have mastectomy, they might require chemotherapy. Chemotherapy and other treatments like hormonal treatment have been demonstrated that decreases significantly the chances of recurring breast cancer. Unfortunately, once the breast cancer recurs, the chances of curability decreases significantly, and the chances of long survival also decreases significantly, despite the most advances in chemotherapy and other treatments, and biological treatment and some monoclonal antibodies. There has been recently significant advances.
So once surgery is complete, it's very important to do the follow-up treatments, whether it's radiation, whether it's hormonal therapy, as you said,
Right.
and chemotherapy. I think a lot of us are familiar with radiation and chemotherapy, but what is hormonal therapy?
Well, breast cancer is one of those malignancies that in many instances are stimulated for estrogens. And so therefore, one of the treatment modalities is block the estrogens in females. And there is a medicine that does this, and that's what we call hormonal therapy. Patients will benefit with hormonal treatment if the specimen, the tumor that has been resected, contains special receptors, the estrogen receptors or progesterone receptors, and therefore the chances of decreasing the chances of recurrences equally as we use chemotherapy.
Okay. Dr. Otoya, we have a lot of viewers who may be interested in contacting you at the Osceola Cancer Center. How do they do that?
Well, they can contact us to the Osceola Cancer Center in Kissimmee. Our telephone number is 407-933-2775.
Thank you, Dr. Otoya. It's been a pleasure having you on the show.
Thank you, John.
We're going to take another short break here, but when we come back, we're going to talk about back pain, sciatica, and other things that make you go, ouch. So don't go away. We'll be right back here on Meet the Doctors.
Are you living in a fishbowl? Call the company with years of experience and thousands of satisfied customers. August Lloyd's manufactures a full line of products such as verticals, minis, 2-inch woods, shades, shutters, and draperies. We have our own factory so we can save you money. We also offer brands like Hunter Douglas, Graber, Levalor, and Kirsch. At August Lloyd's, we offer free in-home service where you can do it yourself and save. Stop by our showroom and see what's new in window fashions, or call today for your free in-home estimate and gift certificate.
Welcome back to Meet the Doctors. I'm John Eastman. I think there will be a lot of you in the audience today who will be interested in our last guest of this program. He is Dr. Mike Gutman. Welcome to the show, Dr. Gutman. Good to have you here. You've got your hands and fingers and everything just into so many different areas, but we're going to talk mainly about pain management today, right?
Well, yes, but I am a neuropsychiatrist, do forensic work, go to the jails. I also do general psychiatry, but my great love now is helping people, giving them a new life, helping them with pain management and specifically back pain and sciatica. I have a revolutionary new approach to it with a special table called VAX-D, and it gets people back to work, relieves pain. It's a miracle.
You're offering hope to a lot of people that maybe didn't have a lot of hope. Is that right?
That's right. There are a lot of people out there that have concentration camp living. They're so desperate, they're so anguished, so unhappy, and really miserable in their lives. and they just need a chance for somebody to be able to give them a helping hand.
Let's go back just for a minute and let's start at the beginning. Where were you trained? How did you learn all of this?
Well, I graduated Miami Senior High School, went to the University of Florida, went to the University of Miami Medical School, graduated, went into the military. I was in Vietnam for a year, came back from Vietnam as the 1st Air Cav Division, and also at the 85th Evacuation Hospital. And after that, came to Central Florida. I've been practicing since 1966, almost 36 years.
So quite a bit of experience here in Central Florida.
Yes, I love it. And I was raised in Miami, and would you believe it, I'm in Central Florida and there's no ocean.
Not too far away, though. Let's talk about pain management and sciatica. For those who don't know what sciatica is, what is it?
Well, sciatica is when the nerves leaving the spine go down to the leg, and they get pinched by degenerative arthritis, osteoarthritis, or bulging discs or herniated discs. Here's a herniated disc at this point. This is the L5, S1, and this is where most of the torque is in the spine, and why we have such a high amount. 60 million people have low back disease.
Really?
Yes, and it is a disease of mostly young men who exert themselves in work. So there's workers' compensation accidents, sports accidents, but many women have the same thing, and they go through life with numbness and pain down the leg from something that is correctable.
So, and is that really the primary symptom, is the pain shoots down the leg?
That's one of the primary ones. Or centralized low back pain in the lumbosacral area between the, there are 5 lumbar vertebrae and discs that go in between. And the disc can bulge like that. Instead of being round, it can bulge and push against the spinal cord or the nerves leaving the spinal cord. This technique is to stretch the spinal cord and suck that disc back in and relieve the pressure.
Now, that's the new technique you're talking, the VAX-D that you're talking about?
Right.
Tell us about that, because up until this point, or until recently, surgery was really the primary consideration, right?
That's right, and surgery it weakens the disc, makes for pain, sometimes relieves some pressure, but this is a non-surgical alternative that is FDA approved and is safe without any types of serious complications, and the healing remains for almost the rest of the person's life.
Really?
Yes.
So a patient walks into you with pain that maybe they've been living with for years, and they don't want to face the surgeon's knife. You can offer them hope.
That's correct. Either we do give them a free consultation.
Okay.
I give them a copy of my book, The Healing Book, which is a complementary alternative medicine. Because at our clinic we have 2 chiropractors, 2 massage therapists, an acupuncturist. I do nutritional medicine, where I offer force feed and push nutrients into the disc and into the body that makes for healing, and the people start looking as movie stars.
So you're really offering a very holistic approach to this, to the problem.
I'm an integrative medicine doctor. I MD, DC, and DO osteopaths in the office, and it's a comprehensive, all-in-one, under one roof approach.
You have what you call the Gutman 5-prong pain protocol, if I can get that all out. What is that? Tell me about that.
Well, prong 1 is neuropsychiatric pain management with medications, sometimes OxyContin.
Whoa, wait a minute now. Now we were talking Botox earlier. OxyContin is one of those words, names, drugs that very controversial.
You're right. It's gotten some taboo element to it. But if I were to ask you, do you like to use gasoline? What would you say?
Yeah, of course.
Of course, it's good for the car.
Right, yeah.
You wouldn't huff it, would you?
No,
okay.
no.
Well, if you inject OxyContin in and it kills you, that's one thing. But you use it properly, it is a wonderful medicine. Or other pain management medicines, anti-inflammatory medicines. There are a new class that doesn't bother the stomach. There's muscle relaxant medicines. So there's a whole complex that works, medications. Then there's psychotropic medicines. 100% of the people will get depressed after 1 year of having chronic pain. So I use antidepressants. Then I use nutritional supplements that force feed and push nutrients into the system. Then I use the accessible doctor. There's a mind-body connection. When I make people feel like they're $1 million and I love them, and I make them feel like they're dignitaries and celebrities at a spa, and they love to come to this place, there's a spiritual enlightenment about my office, and people love to come.
I've heard that it's a very family atmosphere in your office.
And I have a customer service policy, and everybody makes the patient feel like they're number one. And we make your problem our problem.
So let's say someone comes into your office with a problem. What's the first thing that happens to them?
Well, I'm going to examine them, or I'm going to get a history from them. Then I'm going to examine them. I'd like to look at any x-rays. We do x-rays. The chiropractors do x-rays, the osteopath. Then after looking at the x-rays or looking at their own x-rays that they bring in or medical records and the MRI, we look at the MRI, we see what's going on, and if they're a candidate for VAX-D, we will do everything possible to get them on the machine. And it is a machine that splits in the middle, have a corset on the back, you lie flat down, it pulls, and it creates 150 millimeters of negative pressure that actually pulls this herniated disc back in and sucks nutrients into the disc, hydrates it. Nothing can do it like that. Surgery can't do it, injections can't do it, a lot of other procedures
Dr.
can't do
Gutman,
it.
it sounds like you are returning the disc back to its original shape.
That's right. It refibroses back into its old original shape, and that's what happens with herniated and discs, where there is a toothpaste effect through a fissure pushing out against the spinal cord.
Dr. Gutman, there are a lot of viewers, I'm sure, who are really anxious to talk to you about their pain. How do they get in touch with you?
Well, they get a free consultation with me or one of my staff. I believe the more you give, the more you get. Cast your bread upon the waters, it comes back sevenfold. I'm a flag-flying American, and God bless America, and I love to help people.
The phone number at your office is?
Is 999-0051. 999-0051, and we're at a very handy and convenient location, 711 West Colonial by the TD Waterhouse.
Terrific. Thank you, Dr. Gutman. And thank you for joining us here today on Meet the Doctors. It's been an exciting program. I hope you've enjoyed it. Lots of information, lots of great information. And if you happen to be a healthcare professional and you'd like to be a part of Meet the Doctors, all you need to do is call our executive producer, Mr. Roger Perrin, at All TV Network. His number is 407-290-8188.